causality here, and 1.15 for individuals that had LDL concentrations greater than 189 milligrams per deciliter. So essentially what that means is the individuals with the lowest risk of death in this particular analysis from all causes, cardiovascular specific causes, as well as cancer, had LDL cholesterol levels between 132 and 154 milligrams per deciliter, which, lest I remind you, is much higher than what are the current recommendations per the American Association for the American Heart Association and other family practice and internal medicine guidelines. When an LDL cholesterol level is over 130 milligrams per deciliter, it's recommended that clinicians prescribe a statin, a lipid-lowering medication. But let's zoom down. I know these words don't convey the story, so we're going to focus on pretty little pictures. These pictures are showing all-cause mortality. And what you're seeing here are cholesterol levels on this y-axis and hazard ratios for all-cause mortality. The individuals with the lowest risk for all-cause mortality had an LDL cholesterol that is higher than the current recommendations, 140 milligrams per deciliter. And the same holds true for people not on lipid-lowering medication. This, I think, is quite interesting. The people that are on lipid-lowering medication tend to have pretty low LDL cholesterol levels. And we'll talk about that in just a moment, talk about why that might be. Probably because they have pre-existing cardiovascular disease. But if you look at these numbers here, you have 95,000 subjects in this arm versus just 13,000. So as a proportion of individuals that have died, turns out that the people on lipid-lowering medication represent a much higher proportion of the deaths, most likely because they have underlying cardiovascular disease, high blood pressure, obesity, and the sort. But let's go on down. There's another beautiful image here. This is figure 3, okay? And just so you know what we're looking at the multivariable adjusted hazard ratios for cause-specific mortality according to levels of low-density lipoprotein cholesterol, the so-called bad cholesterol. All right, so let's look at just cardiovascular specific mortality. The lowest risk group here, the group that is sort of what everything is based upon because they had the lowest risk of dying, have pretty high LDL cholesterol levels, 132 milligrams per deciliter. So when you go to your doctor and they're freaking out because your LDL is 115 or 140, you might want to take a screenshot of this and say, look, I've been diving into some research, doc. Based upon everything that I see, it doesn't appear that my LDL is really probably contributing to a significant atherosclerotic risk, especially if and only if your triglycerides are low and your HDL is high and you have low body fat percentage. Now, what's interesting is the relationship with low LDL cholesterol and higher odds of dying from cancer. And this highlights potentially this so-called reverse causality, meaning some people that have really low LDL cholesterol